Good afternoon. I'm David Luberoff, Deputy Director of Harvard's Joint Center for Housing Studies, and I am happy to welcome you to this event where the Joint Center and AARP's Public Policy Institute are jointly releasing a new study, Which Americans Have Access to America's Most Livable Communities, an analysis of AARP's Livability Index. Our discussion today will have three parts. First, Shannon Guzman, a researcher at the Public Policy Institute, who's one of the report's four co-authors, will give a brief overview of the Livability Index, ending with a short video. Then Jennifer Molinsky, a Joint Center researcher, who is also one of the report's co-authors, will present some of its key findings. Then we'll shift to a panel discussion where Jen will be joined by Rodney Harrell, the Public Policy Institute's VP of Home, Family and Community, who is also a co-author of the report, and Kathleen Otte, a regional administrator in HUD's Administration for Community Living, who is not a co-author of the report, but will instead bring the invaluable perspective of a practitioner to the discussion. Whitney Airgood-Obricki, a Joint Center researcher who is the report's fourth co-author, won't be on screen, but will instead be monitoring the questions, which we hope you'll pose using Zoom's Q&A feature. She'll answer some in real time, help identify those that should go to the panel as well. I apologize in advance if we don't get to all of your questions, which is often the case. And we're going to do all of that before we sign off at 1:15. So let's get started. Shannon, it's all yours.
Thanks, David. Good afternoon, and thanks for joining us today for the release of our new publication about AARP's Livability Index, Great Neighborhoods for All Ages. Created in 2015, this online resource used by many across the country, including people seeking new homes, local officials, and the Defense Department, is the world's first neighborhood-based nationwide index that measures livability. That is, how well a community meets the current and future needs of people of all ages. And creating livable communities is important in that they provide a variety of opportunities that support individual and community well-being. The index scores every neighborhood and community in the United States for the services and amenities that affect people's lives the most. As the US population rapidly ages and more people state that they want to remain in their homes and neighborhoods as they age, the Livability Index can be a powerful tool for local officials and others in adapting their towns and cities so that residents of all ages can stay active and engaged in community life. The index helps to identify gaps between what people want and need and what their communities provide. From there, community stakeholders can set short and long-term goals that tackle their challenges. No matter where they measure, all communities have work to do to improve their livability so that all people can thrive. Following is a video that provides an overview of the Livability Index from a most recent update in 2018. At the end of the discussion today, make sure to read the report and then visit the Livability Index to find out your neighborhood score. Thank you.
AARP's innovative online tool, the Livability Index, Great Neighborhoods for All Ages, scores every neighborhood and community in the United States for the services and amenities that affect people's lives the most. The index is relaunching with new data and features to further your understanding of livability in your community. The Livability Index is designed to capture what older adults, working professionals, and younger families want and need. Most people want to be able to stay in their homes and in their communities as they age. Yet it truly is an index for all ages, because when we plan for older adults, we plan for everyone. Can people of all ages, incomes, and abilities thrive in your town? The Livability Index can tell you. The tool assesses 7 categories of livability: housing, neighborhood, transportation, environment, health, engagement, and opportunity. Each neighborhood receives a score from 0 to 100. The average place gets a score of 50. To get a perfect score, a place would have to be among the best in each of the 7 categories. Whether scoring high, low, or in the middle, all communities have work to do. Gaps are opportunities to make places more livable. The Livability Index can be used to help people make their communities better places to live and age. The 2018 Livability Index adds several new features. Updated data shows the most recent nationally available data for metrics and policies. And Track Progress allows you to compare a community's performance by indicator for any location. Other new features include the ability to compare map layers and share a score on social media. The tool still allows you to see what policies that support livability a community has in place, compare up to 3 locations side by side, and customize results according to your preferences. How might someone use the Livability Index? Let's consider 3 examples. A grandfather is moving to his grandson's town. He learns that an apartment is near a library, a source for social events and internet access. He also finds high scores in civic and cultural engagement, which promise potential social and volunteer opportunities. A local official wants to know if her community is meeting the housing needs of older adults. She learns that few housing units can support someone who has trouble with stairs, but is connected to resources so she can help her community better serve its residents' needs. A young family just moved. They have 1 car, but need to know if public transportation is kid-friendly and accessible for their toddler stroller and for her grandmother who has trouble walking. The Livability Index tells them what they can expect. Want to know the livability score of your community? To see the index in action, check out aarp.org/livability index. To learn more about the Institute, visit its website at aarp.org/livable policy or find it on social media at AARP Policy and #LiveIndex. That's LIVINDEX.
Thank you, Shannon, for that introduction and introduction to the index. I'm going to start sharing my screen and talk about the research that we did together. I want to thank my co-authors, Rodney Harrell and Shannon Guzman from AARP for partnering with us on this project, and my Joint Center colleague and co-author, Whitney Ergodo-Bricky, for all of her work, and for thanking her also for standing by today for any of the questions that you may have that come in during the webinar. Overall, our research was driven by the question of whether livable access to livable communities is equitable among older adults. We also wanted to know if older adults who move tend to relocate to places with greater livability or not. So marrying the scores from AARP's Livability Index with data from the American Community Survey gave us a way to study these questions. Just a brief word about our methods. We conducted 3 different analyses to get to our findings. First, we needed to understand the characteristics of livable communities in general. And to do that, we used publicly available American Community Survey data to categorize neighborhoods in the United States. In this case, the nation's nearly 218,000 census block groups by their score on the Livability Index. We divided the neighborhoods into quintiles depending on their overall scores, with that first quintile having the lowest livability scores and the 5th having the highest. For those who are interested, the mean livability score in the nation was 50 out of 100, as the video suggested it would be. Those in the highest quintile had a mean score of 60, and those in the lowest quintile had a mean score of 43. We then analyzed the characteristics of the neighborhoods in each quintile, including age distribution, racial and ethnic composition, tenure split, and housing characteristics. Next, to understand older adults' access to livable neighborhoods, we relied on restricted access ACS data to examine the profile of adults aged 50 and over residing in each of those livability quintiles. And lastly, we used regression models to analyze whether older adults move to places that are more or less or similarly livable. So what did we find? Our first finding is that there are some shared characteristics among highly livable neighborhoods. As the video just showed, there is no single neighborhood type that achieves a high score on the index. The index averages scores across 7 categories, and while it helps to have high scores on as many of those as possible, Some places will be particularly strong on the presence of transportation options, for example, while others might be particularly strong on environment. But while livable communities do vary a lot, our analysis showed they have some common characteristics, and many of these relate to housing. The highest livability neighborhoods tend to have more multifamily housing. In that highest level, 44% of the housing units were multifamily on average, while in the lowest quintile, only 10% were, with the remainder single family, though in that lowest quintile, there's also a significant share of manufactured housing. The most livable places have the oldest housing, as you can see in the second line of this table. And the highest livability places also tend to have more renter-occupied housing. Almost half of the people of all ages in those highest livability neighborhoods rent, compared to just under a quarter in the lowest. And finally, the highest livability places have the highest median housing costs. The median rent in that highest quintile is over $1,100 compared to about $900 in the lowest. And the median value of owner-occupied housing follows a similar pattern, with the value in the highest quintile almost twice that of the lowest. Livability quintiles vary by population as well. Higher livability neighborhoods are more age diverse, and overall, most older adults actually do not live in the higher scoring places. This chart shows the share of population in each age group that resides in each of the livability quintiles, with the brown bars, those first bars in each set, representing those in the lowest scoring places, and the yellow bars representing the highest. If you look at the last three set of bars, you can see that the share of older adults declines as one moves from the lowest to the highest, the lowest to the highest livability neighborhoods. On average, just over a quarter of the population in the highest quintile is age 55 or over, but that rises to nearly a third in the lowest scoring neighborhoods. The group that is disproportionately high in the high livability places are young adults ages 25 to 39. In addition to greater age diversity, there were some other demographic findings as well. Overall, the most livable quintile of neighborhoods have the highest median incomes overall. Median income for all households in the highest quintile was $66,000 in 2017 compared to $55,000 in the lowest. And finally, by race and ethnicity, the most livable places have the highest shares of Asian residents and the lowest shares of white residents, while Black and Hispanic residents remain fairly steadily have fairly steady shares throughout all the quintiles. This is very similar to what we see when we look at just older adults, not the whole population. So I'll share a chart on that in a moment. So indeed, the next thing we did do was look specifically at the distribution of older adults across all neighborhoods of high livability. And we found that older adults' access to livable places is not evenly distributed, and in fact does vary across several dimensions: housing tenure, race, ethnicity, income, and the presence of a disability. First, by tenure, renters are more prevalent in neighborhoods with high livability scores. This is consistent with the idea that more livable neighborhoods do have more rental housing, as we talked about before. But this is not just true overall, it is also true for the older population itself, as you can see here. Next, by race and ethnicity, Asian older adults make up a larger share of the population in more livable neighborhoods. As you can see, the share that is Asian increases with each quintile. You can see that in the third set of bars on this chart. While the share of white older adults falls just slightly, but falls as livability increases in that first set of bars. Meanwhile, as I mentioned before, the shares of Black and Hispanic older adults hold fairly steady. This chart just shows you those 65 to 79, but this is a pattern that holds true for 50 to 64-year-olds and those 80 and over. We also looked at household type and the presence of disabilities. We found that single person older households are more common as you go up the livability scale, while married couples are less common. And we also found that shares of older adults with disabilities are highest in the lowest livability neighborhoods. That is, you are less likely to be living in a high livability neighborhood if you have a disability. Lastly, there is an interesting but complicated story related to income. Because this is somewhat dense with all the data that we did collect and is in the report, I'm showing you here only households headed by someone 80 and over, but this is a pattern that holds for younger grade ages too. This is like the previous chart in that each color represents a different level of livability. And you'll notice that among those at the lowest income, the first two sets of bars, there's something of a U shape, with those with the lowest incomes more common in both the highest and the lowest livability neighborhoods than in between. And the reverse is true at the other upper end of the spectrum. At the lower end, why might this be? We know that highly livable neighborhoods are more expensive, but we also know that they often have more rental options in the presence of subsidized housing that can help lower income people find places to live. So that could be part of this puzzle. At the same time, you can see that the share of those in the middle of the income spectrum decline as you go from the lowest to the highest livability neighborhoods. To sum up this set of findings, older people residing in the highest livability neighborhoods on the index are more likely to rent, to be Asian, while white older adults, older homeowners, and those with disabilities are more likely to live in lower livability neighborhoods. And there is, of course, this somewhat complicated income story. Well, these are general findings. Our analysis also showed that people from all racial and ethnic groups, all income levels, those who own and rent, do often live in highly livable places. As the previous charts have shown, there are people with moderate income who live in highly livable places, even if they're less common there. But the highly livable places in which different groups reside vary. And this brings me to the next set of findings. As Shannon described in that video described, the Livability Index looks at 7 categories, and the overall score is an average of the scores in each of these categories. There are therefore many ways a neighborhood or community can achieve a high score on the Livability Index. You can see that in the 2 examples here, 2 places that receive similar overall scores have very different strengths as identified in the index. In particular, between these 2 examples, there's a lot of variation in neighborhood, transportation, environment, and opportunity. So what we found is that the demographic profile of places with different strengths varied. So for example, while on the whole, renters were overrepresented in areas of high livability, when owners do reside in highly livable places, their neighborhoods are going to look quite different from those of renters. And you can see that in this illustration, comparing renters on the left and owners on the right. Older owners living in the highest livability neighborhood are living in places that score particularly highly on transportation, housing, and neighborhood, those first 3 bars. In comparison, on the owner side, health really stands out as a higher score than on the renter side. But there are also scores here that are higher for engagement, which is that gray bar in the middle, environment, which is the lavender bar, and opportunity, which is the final bar at the end. So these are higher in owners' neighborhoods, but housing gets particularly lower scores. There are differences by race, ethnicity as well. Black and Hispanic older adults living in highly livable neighborhoods are living in places with high scores for transportation, housing, and neighborhood features, those first 3 bars again. Notice, meanwhile, that for Asian older adults, the scores for health, the yellow bar, are higher. And meanwhile, the scores for environment and opportunity and engagement are higher for white older adults in very livable places compared to people of color. There are more findings like this in the report, including showing what happens when you layer in income to the story. But in the interest of time, I want to move to our last set of findings. First, we looked beyond just the highly livable neighborhoods to look at all neighborhoods in the US. So for a minute, we disregarded the overall livability score to look just at the neighborhoods scoring in the top 20% on each category of the index. We wanted to see if there were similar patterns in the variation of who was more likely to live in places that had high scores on specific categories. And indeed, we found just that. They're pretty similar to the findings that we found when we just looked at the highly livable neighborhoods. So in this chart, the overall income distribution of the population age 50 and over is at the far right. And you can see that those with the lowest incomes are in the dark brown at the bottom of each column, and that they are overrepresented in areas with the best scores on housing, transportation, and neighborhood, as you can see here, and actually underrepresented on scores like health and opportunity. So again, we find differences by race and ethnicity as well, most of them similar to what we just found with the distribution of the population, that Black and Hispanic older adults are overrepresented in neighborhoods with the highest scores in housing, transportation, and neighborhood, Asian older adults, transportation, neighborhoods, and health, and white older adults are overrepresented in places with high scores on engagement, opportunity, and environment. We will be making these slides available to those of you wishing to study them more closely, because I know this is a quick presentation. Lastly, we looked at what happens when older adults move. Older adults move less often than other age groups, though interestingly, the data showed that those who had moved recently were more likely to have started out closer in to a central business district. In other words, non-movers were more likely to live farther out or outside a metro area altogether. But when older adults do move, we wanted to know if they're likely to move to places of higher livability, which we defined as places that had livability scores 6 or more points higher than their previous residence, if they were staying within a 6± zone, or if they were moving to places of lower livability that were 6 points or more below. And indeed, we found that 3/4 of older movers relocated to neighborhoods with roughly the same livability scores as their previous location. Only 11% moved to more livable neighborhoods and 14% moved to places that received lower scores. Those more likely to move to more livable places were in their 60s. They were more likely to have started out in a higher income neighborhood and to have higher household incomes themselves. And they were more likely to have started out farther out from a central business districts. And of all races and ethnicities, white older households were most likely to make downward moves, as were owners, between owners and renters. So I want to end with a couple of research questions that emerged from this research. I won't get into the implications because that's the job of our panel, and we want to get to that as quickly as possible. The first question that arises from the work, one that our analysis couldn't answer, is if all people within a particular neighborhood have the same access to the features, amenities, and services that contribute to livability. So does lack of income or discrimination, for example, keep some people from benefiting from the livability resources within their own neighborhoods, even in those neighborhoods that have the highest scores? We can't know this for sure. There are many reasons to suspect that this is the case, but understanding all of that and in all of its dimensions is an area for future research. Second, we may wonder why older adults move. When they move, they are generally not relocating to places of higher livability. Older adults' decisions about moving are complex. They relate to personal finances and priorities that may not always mean a move to a place that gets a higher livability score, or a particular feature that is very important to someone is not available in a certain place. For example, someone needing a fully accessible home may be limited in their options. But the finding also raises the question of the extent to which livability is on the minds of older movers, particularly those features that may not be particularly important now, but may be in the future. Another possibility, of course, is that people may not have the resources to make their ideal move. The most livable neighborhoods, as we saw earlier, tend to have the highest housing costs. Our analysis also found that older adults are more likely to be housing cost burdened, paying more than 1/3 of their income for housing when they live higher up on the livability spectrum. So affordability and the presence of housing stock that is suitable for older adults may be preventing many from moving to their more preferred and more livable settings. So I'll stop here so that we can discuss this. The report can be found at this link, and you can also find it through our website. So thank you.
Jen, thank you very much. Really thrilled to hear these presentations. There's an incredible amount there to unpack, and we've got a terrific panel to unpack it. I should also note that the report and the slides will both be available after this event, as will a recording of the event. I want to welcome in Rodney Harrell and Kathleen Otte, excuse me, to the discussion. And Rodney, perhaps kick off with you. The Livability Index is both kind of a measurement tool, but AARP has been very clear, as it was in the video, that it's really to help drive action and policy and what people can do in their own communities. So I'm wondering, as you have gone through the findings and wrestled with them, are there some particular policy implications that jump out? And I guess especially, were there things that surprised you either because the magnitude was even greater than you thought, or because things really looked different than you might have expected?
Hi, David, and thank you. That's a great question. I first want to start off by saying how much I enjoyed working with the team from the Harvard Joint Center on both the report and this presentation today. I'm very excited about this research, frankly, because it supports and demonstrates something that we've thought about for a while. And that's that, no community is perfect, right? That every community has its challenges, and we've known that. We have programs such as our Age-Friendly Communities Network, where local communities are seeking to solve the challenges that they may have as part of our overall approach to livable communities, which is one that seeks to try to implement the policies and changes that each particular community may have to improve along these lines. But the findings here show and emphasize that everyone's not facing the same situation. I've long wondered about the person in the isolated suburb or rural area that may not have as many housing choices. They may, if they want to move, they may not find something to move to. And I think that shows up in those statistics. I've often wondered about the challenges that are facing certain subgroups within the older population. And we see that African Americans, Hispanic, Latino Americans, and others may be facing different challenges in their communities than other older adults do. But part of what's, I think, the surprising note is that we're also seeing the benefits of communities for those wider groups as well. That what you're seeing, honestly, the thing that surprised me the most was that equal proportions of African Americans and Latinos in the highest livability to the lowest livable communities, which shows that those trade-offs that we all have to make between a community choice when we're trying to trade off someplace that's really expensive but has great access to some of the things we need, or someplace that's really far out and isolated but might be in our price range. As we make those trade-offs, we all, or many of us, end up in places that are compromised choices. And so it's very interesting to note that we're seeing people make those trade-offs all over. And my hope is that we can implement the kinds of policy changes that address and attack the issues that are impacting each community, their specific sets of needs, and looking throughout the community to the different types of groups that are within them.
Thanks. Kathleen, I'm wondering, from your perspective as a practitioner, a somewhat similar and actually two-part question. I'm wondering, again, what did or didn't surprise you in this index? And I'm particularly interested, I know that a lot of your work over the last 6 or 7 months has related to the pandemic. And I'm wondering if you think the Livability Index tells us anything about what kinds of communities have been able to respond, can we say, more effectively?
Well, thank you so much. And I will just underscore, I really appreciate what Rodney alluded to when we were talking about the findings, because I think there is some disparity. But I do also think that this particular study is so worthwhile because it takes it to the neighborhood level, which is really what I appreciate, because our states really work very hard to ensure that they are doing much that they can in areas such as transportation, housing, and so forth. Just a little bit of information. I represent the Administration for Community Living. We have been serving older adults since 1965, and the Administration for Community Living recognizes older adults as being 60 years of age. That's what's actually in the Older Americans Act. And I think that's relevant for me to bring that forward because, again, this index has looked at people 50 and above as older. And I think, again, that's really important because all of us would say we are seniors in training. We are all growing older, and we all really begin to talk in a community level about what that looks like. So when you ask me, David, about how this index could be helpful and what really surprised me, I think it underscored some things, but it also surprised me that we only had about 25% of older Americans that were living in that most livable quintile. I think that surprised me that it was just 25%. What didn't surprise me was that we had 32% of older adults that were living in the least livable quintile. So I say that because that leaves a lot of folks in the middle, almost 50%. And why that's important in a community-based setting is that our communities, our state governments are really working towards trying to improve services to make them more available. And I think, again, this particular COVID crisis that we've faced has really been very, very challenging, but also it's really opened our eyes in many ways. And I would even go so far as to say older adults are now recognizing what's available in their community. And I think they've actually had that opportunity to say, I think I need to live closer to my children, or I need to live closer because now I'm socially isolated. My friends aren't available. So I think there's a lot of great information that this index provides that's very, very timely for state governments, and local governments to take a look at what does their community offer for older adults, but even much more importantly, through the lifespan. How can we create a community that will help us age in place and again, encourage people to live where they want to live with the services that they need? So that's kind of my initial thought. It's certainly been a challenging time. Our states and our local communities would say we've served almost 50% more people, post-COVID. But again, I think it brings a lot of things to the forefront.
We're starting to get some really terrific questions in from audience members. And Jen, I want to start with you with one as the housing person here, which is there have been a couple of questions about both, I think, struck by the fact that renters and in many cases lower income folks are overrepresented in livable communities, but thinking that over time, but livable communities are also more expensive. And so how do you think about, or how might we think about making communities more livable, but doing so in ways that don't speed up the process of gentrification?
I think that goes to the larger question about how do we do that in general, right? I think to speak a little bit to Rodney's and Kathleen's comments, although we looked at movers, most people are not going to be moving very far. And when we do know also that when people move, they tend not to move very far. So it really does speak to creating options for people where they live now. And I think that that doesn't just include service options and transportation options, it includes housing options. So we've seen that the biggest growth in older populations has been in lower density areas because people are aging in those areas. They're not moving to them, but they're just aging there. And so I think these are places dominated by single family homes that can be more expensive. They can be more difficult to care for. They can be the least accessible housing that we have. And so thinking about smaller models of housing that by their very nature, because they're smaller, would be more affordable is something that we really, that I know AARP has put out a lot of resources on ADUs and other kinds of housing, thinking about different kinds of shared housing models that might work. So I think just having more housing options is going to help us a little bit, but then there's that larger question that I think, gets that I see some of the questions in the chat on as you create a more desirable, vibrant place to live, more people will want to live there. So you have to kind of bake in this affordability from the get-go, make sure that some of those units are going to be limited, restricted income units available to people on lower incomes, that kind of thing.
Rodney, or were you about to?
Yeah, I was actually about to follow up if I may.
Yeah, please.
A little bit on that. Jen mentioned our work on accessory dwelling units and the idea of, in these places that are already highly livable, how do we get more housing options in them? Places that are near parks and transit and libraries and things that people want. Well, one of those ways is taking our existing properties and providing additional housing options there. So that's why you see us looking at accessory dwelling units or backyard cottages, that kind of thing, as a way to do that. But bigger picture, I think that there's an important need to look at the overall housing types. There's a whole movement around what's called missing middle housing, but the idea that we need a range of housing types and communities. The vast majority of neighborhoods only have single family housing in this country for various reasons. And what that does is it means that if you cannot afford a single family house on a large lot, you can't live in that community, right? And so the idea of creating a range of types of options not only helps with affordability, but it also helps provide the options that people might need, particularly if you're aging or might need something on one level, for example, or you might prefer an apartment or condo. So really getting at a wider range of housing options is I think, the thing that most communities can do.
I was gonna, let me flip this issue on its head a little bit, and this is really both for maybe start with Kathleen and then come back to Rodney, which is we have, as Jen has shown, a huge number of people who are living in lower density single family homes. We know a lot of people want to stay in those homes as long as they can. I think one of the most interesting findings was that people don't seem to be moving to more livable places. And so then the question becomes, how do you make those places more livable, particularly, I would assume, around services? And I would think, Kathleen, that that's a question you've been particularly wrestling with in the recent months. So I'm just wondering if you've got some thoughts about, given the time it takes to get those new units into place for stock to turn over, what can we be doing in the short run?
Well, I have to tell you, again, trying to look at this pandemic of the lessons learned, and I made mention of a couple of areas, but truly, I think our communities are now beginning to look at older people with recognizing that they have special needs, and I use special needs in that there's a varied definition of that, but that even human services like home delivered meals, supports, helping people remain in the community is vital in a disaster, of course, but also in regular times. So again, this opportunity that COVID provided to us was to take a good look at our communities. Quite frankly, I think it's awareness. This pandemic brought an awareness to the issue that heretofore we really have not engaged in. And I think our cities, our communities, our municipalities, all the way up to state government, we're really taking a good look at that. And we're beginning to wonder, have the services we've been providing over the course of time still significant and still effective after COVID? I think one of those discussions is housing and transportation and meals and certainly social isolation, because that's the one key component that we look at as a real deciding factor in our communities. We have people who are living in high rises that are very lonely because they can't get out because of COVID. And how can we bring the community to them in another real sense? We're doing it a little differently after COVID. But I think it's planning, I think it's awareness, I think it's community involvement, and I think it's also, it behooves individuals to speak up and to say what they need and want in a productive way.
Thanks. Jen, I'm struck in looking at your findings that the preponderance of renters living in the most livable neighborhoods. But then I was reflecting on earlier work that you've done, some of it in conjunction with AARP, also showing that cost burdens, there's a whole subset of older renters that are cost burdened. And I don't know if you were able to see if there was any linkage between the renters in the most livable neighborhoods and their cost burdens. But it seems to me, again, that's an issue we might want to be thinking about.
Right. We didn't look specifically at cost burdens by tenure, but we do know from this analysis that people living in the most livable neighborhoods are more likely to be cost burdened, and it follows that those are renters as well. And indeed, cost burdens among older adults are particularly high among renters. They grow with age, so those in their 80s are more likely to be cost burdened than those who are younger. So so that is definitely something that we consider. I mean, and Rodney could probably speak more to this, but the measurements in the index that look at housing include things like the presence of multifamily housing, a diversity of housing options, the presence of subsidized housing. So all of these things are shaping, that score, I think. But what I appreciate about the way the index does this is that it's not just looking at one measure of housing, right? It's looking at the things that in its totality really will matter to people, such as accessibility, affordability, and having the options not to live in a single family home.
Yeah.
Rodney, did you want to?
Sure. I think those are great points Jen's making. And when we look at housing as a category within the index, we are looking at whether or not there's housing accessibility features like zero-step entrances. We're looking at those multi-family housing and other options that 80+% of the country that only has single family housing doesn't do well there. And then we have 3 different measures of housing costs that look at overall cost, burden, and subsidized housing availability, which, by the way, we don't have enough of anywhere. But what you see is, and one of the big challenges I think that comes out of this is that even those places that are scoring highly, housing affordability still is a huge concern. That there's just expensive neighborhoods that have many of the other things in the index, the parks and the libraries and the safe streets and the high environment and opportunity and the like. And so I think that is a single challenge facing us, is the idea that people should be able to have some of those features and deal with the challenges of affordability together. That's really the challenge for policymakers, and we've talked a little bit about that, but it needs to be a focus to make sure that all those folks have the ability to get their needs met.
We're getting a bunch of questions in all related to COVID. But in particular, given the COVID situation, are there elements of the index, Rodney, that you think that I guess it's really for all of you, are there things that from our COVID experience that suggest ways that the index in its next iteration might be tweaked, both about what we've learned that's important, but also some of the constraints that people are living under or with?
Sure, and I know that Kathleen's mentioned COVID a couple of times, and clearly it's on everyone's mind every day. It seems that's one of those things that we're all dealing with. But as Kathleen mentioned, the silver lining of COVID is that it's drawn attention to some of these issues that have been there for a while. I mean, it's a tragedy that tens of thousands of older adults who have died in nursing homes during this pandemic, but it's drawn attention to the idea that we need the range of residential options for people that are aging. And I know when I talk to Susan Reinhardt and our other long-term care experts at AARP, we often talk about the fact that housing and transportation options are two of the biggest needs for people that are trying to leave long-term care facilities. And if they don't have those, they may not be able to stay in the community where they want to be. And so, the pandemic kind of brought that to our forefront. And I'm hoping that after the pandemic subsides, which it seems like it may never happen sometimes, but that we still will pay attention to some of the things that have been raised there. And along those lines, I'll raise the equity issues that have come that were raised during the pandemic. After the death of George Floyd, we had a large national conversation about the equity issues. And the fact that we're showing that people of different racial and ethnic groups are making different trade-offs to try to figure out how to live their best lives and find ways to meet their needs is a huge question. And Jen alluded to the fact that we don't necessarily know from our study whether if you are, say, a white American and a Latino American in the same community, whether you have the same access. We do know from things like Newsday's study last fall that housing discrimination still exists, that there's people that are being discriminated and not able to find those homes. We know from some of the Black Lives Matter protests and other conversations that people aren't feeling involved in their community decision-making, or there's statues being left in parks or other decisions being made that are leaving out community members of one race or one group or another. And so the idea that this COVID and this awakening around equity issues should stay with us, that we want to have more options, make them available to all, and make sure that all community members are part of our work as we're trying to create these livable communities for all.
Kathleen,
well, I just wanted to say too that, and as much as the index and the current situation shows us where some of these gaps are for older adults, I think that you could extend that to caregivers as well, right? And so people living in low density locations, having trouble affording housing, having limited transportation options, as more people wish to remain in their homes for a longer time and bring the services that Kathleen's talking about into their homes, to help them to stay. That is a real challenge for the caregiving community, the informal caregiving community, but also those who are paid very low wages and may not have, the same similar problems with housing and transportation and all that.
And Jen, I'll just jump in quickly to piggyback on that I think family caregivers themselves are a great audience for the kind of conversation we're having, that they're seeing these issues that are being faced by their family member. And perhaps while we're seeing that older population may not be moving to more livable spaces, I think there's an opportunity to talk to those folks and have caregivers understand the needs as we're aging, and perhaps have a housing choice, or not be as isolated, or whatever the challenge might be as they're aging. So I think there's a great opportunity to speak to that audience about what we're finding.
Kathleen, I just build on this. There's been a couple questions asking for and suggesting you're probably in the best position to answer some specific examples of a community or communities that have wrestled successfully with or seem to be wrestling successfully with some of these issues. What is this? What might making a community more livable, particularly for older adults, what does it look like in practice?
That's a great question, and I do have some examples, and they might seem somewhat simple examples, but I think they're very important. And I couldn't agree more with my colleagues, Rodney and Jennifer, because I think they're right on target. But we have built an aging network to provide services and supports for older Americans. And I would just say that the face of older Americans are changing, and even their living environment, the caregiver, and that many of our people over the age of 50 are providing care for grandchildren now due to the opioid issues, as well as their parents. So they're kind of caught in the middle of the sandwich generation, as we all know. But some examples that our aging network have done that underscores their dedication, number one, and then also how they really care about their community. When we were trying to deliver home delivered meals to people in our southern states, and there were no drivers available, an area agency on aging contracted with a beer distributorship. They had refrigerated trucks. They weren't making beer deliveries. And indeed, what they did was just work with the aging network to make sure that community was served and meals were delivered. That's one example. Another example is contracting with a caterer that really had worked with an airline for years, and then all of a sudden found that their contract was null and void because the airline was not ordering any meals. And again, those kinds of things. It's innovation. I think, again, it's also that human service passion that we feel within the aging community to really help fill a need through our aging network providers, our senior centers, our state governments, and I will even include our federal partners to really help underscore that people want to remain in the community. We need to be there to provide them with the services we can so that they can remain independent.
Jen, in a way, building on that, there's a question about, actually this could be for any of you. How might we think about renovating or altering the existing housing stock to make communities more livable and allow people to remain in the communities that they want to remain in? So is there a role here for kind of renovation, remodeling?
Oh yeah, definitely. Long before this project, Rodney and I have had in-depth conversations about just the data we need to understand the needs that we have. It's pretty limited, but what we do know is that less than 4% of our housing has some basic features, and that doesn't make it a fully accessible unit. If you, as somebody in our chat said, if you can get through the door, it doesn't mean that it's fully accessible. So for sure. So there's, I think, two things to think about on that score. One is what can localities, states, and by local governments do. And there are various programs that are in effect, visitability ordinances that try to encourage new housing to be built with certain features or to be built to be easily adaptable in the future. So that's one way to go. At the state level, Vermont has a program, for instance, and that extends to single family houses, which again is a really important thing because nothing else will really do that in terms of the single family house. For individuals, there are lots of grants and loan programs to help low income people who have documented disabilities make changes when they need them. I think we need more of the programs that help people make changes before they need them. So it's just to make their house safe and secure for the future so that they can live there without fear of falling or injuring themselves or something like that. So those are some ideas. I think there are great examples out there. It's more of a scale issue. How can we get more places to do this and provide more of these programs?
I'd even jump in.
Go ahead,
Kathleen, and then Rodney.
Okay, I'll be brief. I think also a paradigm shift. We need to think differently about how we want to live. In other words, what about cohabitation? What about shared family opportunities? We really haven't taken it to the next level yet, which I hope we do. And again, I always say seniors today look a little bit differently. And so my hope is that seniors come forward and be able to express the opportunity of living differently than our preconceived notions might hold. Rodney?
Well, and that perfectly builds on the point that, or I can build on that point with the point I wanted to make, which is that we've spent centuries in this country with an assumption that we've had more children and young families than older adults. And the Census Bureau says that sometime in the next decade, for the first time in US history, we're going to have more people over 65 than under 18. And what that means is we need a shift. We've been spending 400 years building communities and housing and the like that doesn't necessarily work for aging. And we were successfully and safely able to say that, well, it's going to work for most people, so we don't really need to focus on needs as we age. But now that is happening. And so, I think you can see this movement. I've seen it since the time I've been at AARP, that more communities are understanding. So more people in the industry, in the building industry, are understanding it. But we need solutions both for today, the remodeling and trying to make the systems work and the programs that fit within the gaps that are in our communities. But we also need solutions for tomorrow, which is actually building our communities differently, our housing stock differently, the like, to make sure that fewer people need these kinds of solutions that fit those gaps. And one other thing that Jen brought up that I wanted to kind of tackle, and that's that with the index, somebody mentioned that we only look at zero-step entrances, and I want to talk just quickly about the philosophy behind why that is. And the idea is that the index, and no national index, can measure every factor that's out there. But we got a technical advisory committee together and picked kind of this key indicator so we can create a fair measuring stick across the country and look at those key attributes. So that zero-step entrance is frankly the best measure you can get nationally to look at accessibility, but it absolutely doesn't cover everything. And we hope that the index is used along with local data and other data to really dive deep into what's going on in communities. And we're hoping that this tool gives people the ability to kind of check in on that fair measuring stick to see how they're doing compared to other communities or those general attributes.
We're coming towards the end, and I actually want to throw out, I guess, from my researcher heart, a question that came up in the chat for each of you, but also to let you have an opportunity to, if there's something important here that we should have been discussing and haven't gotten to. And the question is, and Jen, maybe we'll start with you. What data do you wish might have been available either from the index or from the ACS that, I guess if we granted you one data wish, what would you hope for? Something that would be a helpful measure in trying to really get your arms around, better get your arms around this issue.
One data wish, David. That's
all right. You can have
researcher. Look, we're always looking for more data on accessibility for sure, and I think some imaginary data set that would really help us understand equity within communities would be, that's something that we couldn't tackle with this, but that we suspect is an issue, right? So I'm not sure what that would look like, but within communities, does everyone have the same access to the kinds of things we're talking about would be really important.
So that might be something like, and one of the measures was access to healthcare at a community level, but does that mean everybody can actually pick up the phone or get to a walk-in clinic?
Right, yeah.
Rodney, is there a measure, either real or mythical, that you'd love to see included in the next index?
Oh, that's opening Pandora's box about what I wish I could get.
It's not. It was just one of the audience members. I have nothing to do.
But like Jen, actually, the top on my list is that accessibility thing. It's frustrated me how little we do nationally pay attention to accessibility needs and the needs of people with various ability levels and being able to get that in. I'd say that more environmental measures that are better able to get at the environmental justice factors and what each community is facing. Those are something else that's been big to me. An opportunity space that, it's very hard to find all of the things that are going on in communities and capture them in a way. And if you're out there creating your own index that we could incorporate that would look at all of the factors that communities have that provide opportunity equally to their residents. That's something else I'd love to have. I mean, honestly, there's factors in each of these categories that I wish that we could measure better. But I'm at least satisfied to know that I think we touch on all of the key things that people of all ages need to make sure that their communities work for them, no matter their age, no matter their income level. If your community's got that for all people in different parts of the community, I think you're in good shape. And this might give you some insight into the types of things you may want to look at in your own community level and understand what you all might need to address.
Just to chime in, because I'm not a data person, but I will say two trends that we note as we look at older adults, particularly people 60 and above. One is what I've just recently referenced, which are more grandparents are raising grandchildren. This particular data and statistical point is just rising exponentially. And so again, in few years more, it might be something for us to look at. The second thing that you can't do everything, but adult protective services and self-neglect. Recently, we came out with 4-year data, all of the states providing information that shows almost 53% of the founded cases in the United States were self-neglect cases. Many of those cases are people who are self-isolating, who just don't have access to supports or families. But I think, again, we could learn something by looking at that particular population. So I think that's, from a non-statistical person, that's something I think might be helpful.
No, I mean, I think it's crucial, because what you're seeing on the ground, should inform, what it is that we're looking at. Hugely important. Any last minute issues that we should have flagged that I didn't get us to from any of you?
I would tag on to the last point, that I think social isolation has become very real for all of us of all ages in this pandemic. That the experiences that many of us have had, in quarantine, hopefully make us a little more empathetic to the experiences that many older adults have, in daily life before the pandemic. And so coming out of this, thinking about there's a lot in the index about engagement, but thinking about loneliness and isolation and specific ways to engage people is something that's on my mind.
Mm-hmm. I think those are good. I think there's two things that I'm thinking about. One that we didn't touch on was the tendency of governments, especially, and us as individuals, to silo things. And one of the things we've tried to do with the index is to give this broad measure across things. And the study shows that you're making trade-offs in one place for another. And so, my biggest policy wish is that we actually start to look across areas, that housing agencies and transportation agencies and environmental agencies and education agencies all start working together and knowing that the work that they're doing impacts others. And frankly, that communities and community leaders and even in the business sector understand that as well. So I hope that happens. My biggest wish for consumers is that people start to think about their long-term needs, that people think about the fact that they may have a disability at some point, their spouse or family member may pass on, there may have an income change. So, as you're thinking about your housing decisions, think about what you might need for the long term as well. And then finally, getting back to something we talked about earlier about the difference between groups, I just want to emphasize that even if you're having a high livability score, for example, we pointed out that Asian Americans tend to live in higher livability places. That doesn't mean that life is peachy keen, right? It means that there's the average neighborhood is slightly higher in health and some other categories, but it doesn't mean that people are not facing challenges, that people are facing challenges. People are making those compromises no matter what community they're in. And my goal for policy is that we can make the need for those adjustments, the needs for those compromises less and less, and for fewer people, that people can be better able to meet their needs and live their best lives. So if we make those points, I think we've done a good job.
David, just to add, I think what's really important and the awareness that I would like to see is the livability study. This is a great study. And I think, again, it drills it down to the neighborhood so that we can take a good look at these different challenges, the different opportunities. And I hope communities take note of this. I wish for awareness. That's what I wish for. I hope people become much more alert and aware to their environments, and also what they can do to improve where they want to live and how they want to live.
Well, we could keep going for quite some time. There's so much in this report. I'm struck again listening to the conversation. You know, we know from all the research on the internet that, you know, anything that gives you an index or, you know, where do you rank, and that's sort of the first thing. Like, you know, what did my community score? You know, what did the community I used to live in score? And I think the conversation has been a great reminder, and the research that we've been talking about of getting past that sort of scorekeeping to really think about both, you know, where does my community work, where doesn't it, what can I do, and then think about what can I do at an individual level, or you know, at a larger level, which would be the result of a bunch of individuals pressing in a particular direction. It's a terrific study. I encourage all of you to read it. It will be posted, probably is actually already posted at both AARP, and a link to the study from the Joint Center website. And we can't all show you our gratitude by clapping, but I do want to thank Jen, Kathleen, and Rodney for just a terrific conversation, and for keeping these really important issues in the fore. I hope you all have a great afternoon, and hopefully, you know, it's snow. I think the snow is just about stopped here in the Boston area, and it'll go away, and we can have a nice fall. Have a great afternoon, everybody, and thank you very much for joining.
Thank you.